Hi everyone, it's Emma here, and this week I am exploring the topic, can PCOS give you UTIs? So PCOS is characterised by cysts in and around the ovaries, an increase in androgens, the kind of male sex hormone, although females still have some, and or a lack of ovulation. So some or a mixture of these symptoms, and all of these separately can impact the bladder and the urinary tract, and I'm just going to talk through a bit about how some of those mechanisms can be involved with PCOS and then impact the bladder. So first of all, we have that hormone imbalance. So typically high testosterone, high androgens, but this then affects the ratio of our other female sex hormones, so that's your estrogen and your progesterone levels. There's a bit of a debate in the medical community whether or not estrogen is generally high or low. Some say low relative to testosterone, so sometimes it is that ratio, but then there is a lack of ovulation as well, which means that we aren't getting enough progesterone to balance estrogen, so potentially that could mean that estrogen is too high. But this may fluctuate throughout the month, but not in the usual fluctuations that we would expect from a typical menstrual cycle. And it is clear from research that these imbalances in hormones do somewhat affect the bladder, and androgens can also affect the pelvic floor muscles as well in a negative way. So that's the hormone side of things, but another important area is the blood sugar regulation, and insulin resistance is thought to have a huge impact in PCOS. This may be the main driving factor which can then drive that hormone imbalance, so this is a really important one to consider. We also have structural changes as well that could potentially give rise to symptoms of cystitis or urinary tract infections. Also, when I mentioned the blood sugar as well, we know how big an effect that can also have in cystitis. But back to structural, so that could be the cysts that have a problem on the bladder, or there could be surgeries or other procedures that have went on that could then impact the bladder. The ovaries and the bladder are going to be in very close proximity. So what can be done around all of that? First of all, we've talked about hormones and that underlying hormone imbalance. Now, something like Agnus cassis may be helpful in cases of hormone imbalance, but you will notice that this is licensed for symptoms of PMS rather than PCOS specifically. So this would definitely be one to get in touch with us directly just to see if it might be suitable. It may not always be suitable in cases of PCOS specifically. Then blood sugar, that's often one of the main areas that we can focus on, especially from home. And this, as I say, can have benefits for your urinary tract, for your hormone imbalance. So this is a really nice one to focus on. So we're thinking about diet here, upping your fibre, your protein, your healthy fats, trying to reduce refined carbs, refined sugars, and processed foods as well, which can be high in refined carbs, but also very inflammatory, and inflammation is also thought to be an important factor in PCOS and in cystitis and UTIs. Then we have other supplements that may be helpful, such as cinnamon, a good one to include in your diet. Chromium is a nutrient, a mineral that can be very helpful for blood sugar regulation and insulin sensitivity. Then gut health, both for your blood sugar and for cystitis. So things like your prebiotics, such as Mulkazan, can be helpful, and or your probiotics, such as your female probiotics, again very helpful in both cases of PCOS and urinary tract infections. There's also just that diabetes link there as well, which of course all links into your blood sugar regulation, so there are important links there. Exercise can be really helpful for a number of reasons. So your blood sugar regulation and your insulin sensitivity, like we've mentioned, for helping to maintain body weight, and body weight has some links with PCOS and potentially extra pressure on your bladder and surrounding areas, your pelvic floor muscles, for example. And then stress is another one. I just wanted to touch on. Stress could potentially drive hormone imbalances as well, sex hormone imbalances, and also could be detrimental to your immune system as well, which we need to detect infections, UTIs. So just something like your stress relief daytime could be part of the regime there, the overall supportive regime. Finally, of course, if you do have symptoms of urinary tract infection, then something like your UTI would be something you would want to introduce quickly to target those symptoms head on. So to help relieve those urinary symptoms associated with cystitis and UTIs, the UTI would be one to introduce quickly. Hopefully that has helped everyone. Please do leave any comments or questions below and I will get back to you. I will put any product or research links in the description, and if you are watching this on YouTube, please do subscribe to our Avogo YouTube channel and also hit the bell icon so you will be notified of any future videos. Thanks.